Welcome to Learn This, the show that takes you to the front of the class. Today, we get hands-on with the curative powers that are students in the nursing program. Afterwards, we're getting a full physical checkup from nurses-to-be. Only on Learn This.
Hi, I'm Eric O'Brien.
And I'm Haley Albertson. We will be your hosts for this week's installment of Learn This.
I'm excited for the show today because we're taking a look at one of the most prestigious programs here at Algonquin College, the nursing program.
We will be talking to a former student who will help give us some insight into what a day is like for a nursing student and what you can do to become part of this program.
We get a chance to look at some of the equipment and facilities they use in the nursing program, including the real-life simulators and the brand new smart apartment.
Having this opportunity to look into the program has given me a whole new insight into nursing and all of the hard work and dedication it takes to become a nurse.
You can say that again. And later we'll find out why the doctors try and blind us during a checkup or why they stick a popsicle stick down our throat. And yeah, that's a tough question.
I can't wait. But for now, let's take a look at some of the stuff you'll find at the Algonquin College nursing program. Let's take a look.
So I'm Crystal Showerty and I coordinate the practical nursing program year 2. So currently I teach in the pharmacology course and I also teach in the lab setting, but I have taught in the theory courses and in the health assessment courses, so it varies from year to year. We have a 2-year program at the college, we have a September intake and we have a January intake. We roughly get about 130 students in our September intake and about 90 students in the winter intake. Our program is divided in year 1, you do a lot of health promotion, clinical activities, and clinical rotations. You work in long-term care facilities, and the skills you're learning is you're learning how to do a health assessment on a patient, you're learning how to do bed making, bathing a patient, washing a patient, feeding a patient. And then when you get into year 2 of the program, you're doing medical surgical placements within hospital settings in Ottawa, such as the Ottawa Hospital, the Civic Hospital, CHEO, St. Vincent's, so a variety of different placements that they'll get to work in. I think the main thing coming into the program that you have to be aware of is that it's a challenging program, but definitely doable if you have the determination that you want to be able to do it. Somebody who likes working with people, who likes working with science, who likes to be able to work with hands-on skills would probably be a good candidate for the program. Since it's a 2-year program, at the end of their 2 years, they do a preceptorship placement, which is 8 weeks. And it's like an on-job training co-op placement. And so many of those students, after they have completed this program, many get job offers or they get other job opportunities. But we do help with resume building, helping prep for interviews. Yeah. When you enter into the nursing program, we have a lot of different facilities that promote learning within our program. So presently you are in our large simulation lab, so all of our students have access to this lab to do lab skills. Presently you're in the OR, so it's a simulated OR that you would find just as you were in a normal hospital. We just recently built a smart apartment, and we also have various other labs throughout the college as well. And so our labs, we really promote hands-on learning to promote the skills that are needed for the nursing program.
I hope you enjoyed the tour of the nursing department. Joining us now in the studio is Elizabeth Krause, a recent graduate from Algonquin College and Ottawa University joint program. Welcome.
Welcome. Thanks.
So tell us about your time there at Algonquin. What did you enjoy most?
Well, it was a great 4 years. It was a long and hard program, but I'm definitely happy to be on the other side, having finished now. It's nice to look back and have gone through so much with a lot of great people.
Right. And I understand that it's a joint program, so you're working with Ottawa U and Algonquin. So
Exactly.
How does that work exactly?
So the first 2 years we spent mostly at University of Ottawa. We were doing our courses, we were doing lectures. The last 2 years we were strictly at Algonquin. So it's where all of our labs were, we had lectures there as well. And it's where all of our clinical placements were also organized through.
Awesome. And you must have had a favorite part. So tell us what your favorite part of it was. Was it the classes, the teachers?
I really like the labs. So a little bit of what you saw just beforehand. They have the neat, essentially patient robots, it was a time where you really got to put your hands on the equipment that you would then go see in your clinical practice. So it was where we'd learn how to deal with IV fluids, learn how to deal with pumps, learn even just how to move patients is very daunting when you haven't done it before. So it was really helpful to have that time to practice, get more comfortable, and then do it in real life.
Right, so that's awesome. And the labs are in class or outside of class?
Yeah, so we have specific time. It would usually be in about 3-hour blocks where we'd just be in labs. So we'd come in scrubs, we'd bring our stethoscopes, and it would just be small groups, about no more than 12. And it would be us, our lab teacher, and then we could fire any questions we had at any time. So it was great because you had it in your hand. You were able to have someone who was so comfortable with it, tell you exactly how to use it, and you could ask questions whenever you needed to.
Okay, nice. And outside of class, were your facilities still like accessible to you, or?
Yeah, we had some open lab times which were helpful. So we'd frequently have lab exams. So you'd go in, it'd be 10 minutes of just you and your instructor, and it would be terrifying. So if you weren't confident with a skill, you always had open lab time that you could go, you could practice more, and then be comfortable for that exam.
Okay, so that means your teachers were accessible outside of class.
For sure, yeah. If it was during lectures, you could always come in breaks and ask them. They had really great office hours where you could get the support you needed if you felt like you were having a harder time.
That's awesome. And so you must learn a bunch of skills. I know you talked a little bit about that already, but tell us more about like the skills that you learned in class.
So in the RN program, you definitely learn a lot about IV medications, drugs, how to safely give medications, how to place patients in a certain way, how to do a really thorough assessment. I think that's the most important thing, was how to do a thorough assessment and how to communicate properly with your team of what you found during that assessment, because that's what can save a life. That's what can make a difference in a patient's day or how they're going to do.
Well, fantastic. Well, thanks a lot for being here with us today. Earlier today, I went to the nursing departments and we met up with Tracy Henderson, the program instructor, who showed me the ins and outs of the live human simulators. So let's take a look. Hi guys, we're here in the nursing simulation labs where we're going to be seeing some of the equipment they use around here.
Hi everyone, my name is Tracy Henderson and I'm one of the instructors here in the nursing program at Algonquin College. We're standing in A134, which is our simulation lab. It was opened in 2005. And this is an example of one of our simulators. We've come a long way in terms of simulator from the old Resuscitation Annie. I'm going to walk you through some of the uses that we have here. We use these type of mannequins in some of the upper levels of our programs when we need to allow students to be able to interact and engage with our clients. The great thing about simulation is it allows for that experiential learning to happen without the impact of client safety. Baby Hal works similar to the same technology that we spoke about with our sim man over there. We have the ability to change the parameters of his vital signs, so we can change his breathing patterns. As you can hear, he's crying at the moment, but we also have the ability to simulate a breathing difficulty, quite significant cough, and so this again allows the student to experience what it's like to have to make those clinical judgments and make those decisions when you have baby who's quite upset and usually mom at the bedside. And so again, it speaks to that experiential learning component and allows them to make mistakes in a very safe environment where we don't have to worry about client safety.
Hi guys, and welcome. We're here in the smart apartment and Tracy is going to be showing us a little around.
Guys, welcome, come on in. So in healthcare in Ontario, we see a huge shift towards community nursing, and so in an attempt to address that needs for our demographic here in Ottawa, we have created a new smart apartment. So you see we have a laundry facility, dining room, kitchen. We have a regular bedroom. And
wow.
So
it's nicer than my bedroom.
it is nice, yes. So again, students in this apartment have the opportunity to practice making some basic meals, some light housekeeping, interacting with the client in their own home.
Well, now it's time to head back to the studio.
Well, we're back in the studio with Elizabeth, and we're going to get physical. So, Elizabeth, what do you have to show us today?
So today I've brought the lovely blood pressure machine. This is something that I use on the job every hour, if not more. So we're going to take your blood pressure this morning. So I'll just place this.
So does it matter like what arm you put it on normally? Or
No, you can put
whatever
it on
one?
either arm. Sometimes when patients have certain large IVs, I can put it on a leg even.
Okay.
So I'll have you rest your arm just right now, and I'll run it while we chat.
Is there any like specific position I should be in, or just like relax?
Relaxed like that is perfect. So it's going to be inflating. What it will produce is a systolic and a diastolic number. So you'll get one over another. So 120 over 80 is our regular.
Okay. So what does the top number mean?
The top number is systolic. That's the pressure that the heart is enforcing on the vessels. So that's in the squeezing of the heart. That's the biggest pressure that's pushing through your veins and arterioles.
Interesting. And so what's the bottom number?
The bottom number is the pressure of your vessels at rest. So the diastole. So your heart's relaxed, but there's still pressure going through your veins.
Okay. And so when do you normally have to take someone's blood pressure? Like what would prompt you to do that?
So I work in intensive care. So I take blood pressure as part of my vital signs, which I do every hour. And then if a patient's in distress, I'm also going to be checking their blood pressure, their temperature, their heart rate, their respiratory rate, all those things. So this tells me how well they're perfusing their organs.
Okay.
So in my job, typically when patients are really sick, I see them having low blood pressure. So I think the lowest blood pressure I've ever seen was 40 over 12.
Okay.
So that was a really bad situation, but luckily
what
we're able
happened?
to get better. We gave some medications, we gave some fluids, and with that, the blood pressure was able to get back to a normal state. So your blood pressure here, you've got 122 over 72.
That's good.
Pretty much perfect. That's fantastic.
So what is like if a patient has a really low blood pressure? What are the steps you have to take to like get it back up?
All right, so with a really low blood pressure, the first thing we like to do is give fluids because it's possible that they're in shock for a couple different reasons. So they could be hypovolemic, meaning that they're just missing volume in their veins. They could also be in septic shock, meaning that they're very sick from an infection. Okay. They could be in hemorrhagic shock as well, meaning that they've had a bleed. So depending on which shock, you're going to treat it a little differently. So you can do fluids if you're low on fluids. If you're sick, it's really important with an infection to get fluids and antibiotics. And then if you're bleeding, you want to replace with blood.
Awesome. All right, so what else do you have to show us today?
So right now I'm going to do a really quick head to toe.
Okay.
So this is something I do 3 times, if not more, a shift. Every 4 hours I do an assessment. So I would start from head to toe, just as I said. So first I check your pupils.
Okay.
So you're able to close your eyes for me.
Okay.
So close your eyes.
If you want to just go through the steps quickly, that'd be great.
Sure, yep, close your eyes. I'd look if they're equal and reactive. I'd check if you're gonna have equal strength in your hands, wiggle your toes. I'd be listening to your heart and your lungs.
Okay.
I would also go to listen to your belly for bowel sounds, and I'd be checking to look at the color of your skin. Are you warm? Do you have any different coloring in your legs? And I'd be feeling your pulses as well. So that's a brief head to toe.
Okay, and do you want to quickly show me how you do that?
Sure, so I'll listen to the back of your chest here where you can get the best sounds. So I'll get you to just take some deep breaths, okay? And out, perfect.
Well, you've definitely taught me a lot about what the doctors are doing while I'm sitting in their office. I'd like to thank you so much for being here today, and respectfully, I hope I don't have to come visit you anytime soon.
Hopefully not.
Well, be sure to tune in next week where we take a look at the aircraft maintenance program here at Algonquin College.
That's all the time we have. We hope that you have learned just as much as we have. I would like to especially thank Tracy Henderson, Crystal Showerty, the program coordinators, for allowing us to access their facilities, and to Elizabeth Krause for coming today.
Yeah, thanks a lot for coming. I'm Eric O'Brien.
And I'm Haley Albertson. We'll see you next time.